Rosacea is a common skin condition that affects millions of people worldwide. It is a chronic inflammatory disorder that primarily affects the face, causing redness, flushing, and visible blood vessels. In some cases, it can also lead to the development of pimples and bumps on the skin. The exact cause of rosacea is unknown, but it is believed to be a combination of genetic and environmental factors. Some of the factors that can trigger or worsen rosacea include exposure to sunlight, extreme temperatures, stress, and certain foods and beverages. Rosacea can affect people of all ages and skin types, but it is most commonly seen in fair-skinned individuals between the ages of 30 and 50. Women are also more likely to develop rosacea than men, although men tend to have more severe symptoms. There are 4 subtypes of rosacea, each with its own set of symptoms. The first subtype, erythema totalangectatic rosacea, is characterized by redness and visible blood vessels on the face. The second subtype, papulopustular rosacea, also causes redness and visible blood vessels, but it also leads to the development of pimples and bumps on the skin. The third subtype, phymatous rosacea, causes thickening of the skin and enlargement of the nose, chin, forehead, and cheeks. The fourth subtype, ocular rosacea, affects the eyes, causing redness, dryness, and irritation. Although there is no cure for rosacea, there are several treatments available to help manage the symptoms. These include topical and oral medications, laser therapy, and lifestyle modifications such as avoiding triggers and practicing good skincare. If you suspect that you may have rosacea, it is important to consult with a dermatologist for an accurate diagnosis and appropriate treatment plan. With proper management, most people with rosacea are able to control their symptoms and enjoy clear, healthy skin. Rosacea is a chronic skin condition that affects millions of people worldwide. Its exact cause is not yet fully understood, but several factors have been identified as potential triggers for the development of rosacea. One of the primary factors that contribute to the development of rosacea is genetics. Studies have shown that individuals with a family history of rosacea are more likely to develop the condition themselves. This suggests that there may be a genetic predisposition to the disease. Another potential cause of rosacea is abnormalities in the immune system. Researchers have found that individuals with rosacea have higher levels of certain inflammatory markers in their blood, which may be indicative of an overactive immune response. Environmental factors may also play a role in the development of rosacea. Exposure to sunlight, extreme temperatures, and certain chemicals can all trigger symptoms of rosacea. Additionally, certain foods and beverages, such as spicy foods and alcohol, have been known to exacerbate symptoms. Finally, some researchers believe that the presence of certain bacteria on the skin may contribute to the development of rosacea. These bacteria are thought to produce substances that trigger an inflammatory response in the skin. In conclusion, while the exact cause of rosacea is not yet fully understood, several factors have been identified as potential triggers for the disease. These include genetics, immune system abnormalities, environmental factors, and the presence of certain bacteria on the skin. Further research is needed to fully understand the underlying mechanisms of rosacea and develop effective treatments for this chronic condition. 1. Salmon. Salmon is a great source of omega-3 fatty acids, which have anti-inflammatory properties that can help reduce redness and inflammation associated with rosacea. 2. Green leafy vegetables. Green leafy vegetables like spinach, kale, and collard greens are rich in antioxidants and vitamins that can help protect the skin from damage and promote overall skin health. 3. Ginger. Ginger has anti-inflammatory properties that can help reduce redness and inflammation associated with rosacea. It also contains antioxidants that can help protect the skin from damage. 4. Turmeric. Turmeric has anti-inflammatory and antioxidant properties that can help reduce redness and inflammation associated with rosacea. It also has antibacterial properties that can help prevent infection. 5. Oatmeal. Oatmeal contains compounds called avenanthramides that have anti-inflammatory properties. It can also help soothe and moisturize the skin, which can be beneficial for people with rosacea. 1. Spicy foods. Spicy foods can trigger rosacea flare-ups due to the presence of capsaicin, which causes blood vessels to dilate and increase blood flow to the face. This can lead to redness, flushing, and inflammation. Avoiding spicy foods can help reduce the frequency and severity of rosacea symptoms. 2. Alcohol. Alcohol is a common trigger for rosacea flare-ups. It dilates blood vessels and can cause redness, flushing, and inflammation. Additionally, alcohol can dehydrate the skin, making rosacea symptoms worse. Limiting alcohol consumption or avoiding it altogether can help manage rosacea symptoms. 3. Dairy products. Dairy products, such as milk and cheese, contain proteins that can trigger an immune response in some people, leading to inflammation and rosacea flare-ups. Switching to non-dairy alternatives or limiting dairy intake can help manage rosacea symptoms. 4. Citrus fruits. Citrus fruits, such as oranges and lemons, contain acids that can irritate the skin and trigger rosacea flare-ups. Avoiding citrus fruits or limiting their intake can help manage rosacea symptoms. 5. Processed foods. Processed foods, such as packaged snacks and fast food, contain high levels of preservatives, additives, and artificial flavors that can trigger rosacea flare-ups. Eating a diet rich in whole, unprocessed foods can help manage rosacea symptoms. Rosacea is a chronic skin condition that affects millions of people worldwide. It is characterized by redness, flushing, and bumps on the face, and can be quite uncomfortable and embarrassing. While there is no cure for rosacea, there are several things you can do to prevent it from occurring or worsening. First and foremost, it is important to protect your skin from the sun. Exposure to UV rays can trigger rosacea flare-ups, so be sure to wear sunscreen with an SPF of at least 30 and avoid direct sunlight during peak hours. You can also wear a wide-brimmed hat or use an umbrella for added protection. Another way to prevent rosacea is to avoid triggers that can cause flare-ups. These triggers can vary from person to person, but common ones include spicy foods, alcohol, hot beverages, and extreme temperatures. Keeping a diary of your symptoms and identifying your triggers can help you avoid them in the future. Maintaining a healthy lifestyle can also help prevent rosacea. Eating a balanced diet, exercising regularly, and getting enough sleep can all contribute to healthier skin. Additionally, stress can be a trigger for rosacea, so finding ways to manage stress, such as practicing yoga or meditation, can be helpful. Finally, it is important to take care of your skin. Use gentle, non-irritating products and avoid harsh scrubs or exfoliants. Moisturize regularly to keep your skin hydrated, and avoid using hot water when washing your face. In summary, preventing rosacea involves protecting your skin from the sun, avoiding triggers, maintaining a healthy lifestyle, and taking care of your skin. By following these tips, you can help prevent rosacea from occurring or worsening. Rosacea is a chronic skin condition that affects millions of people worldwide. It is characterized by redness, flushing, and bumps on the face, particularly on the cheeks, nose, chin, and forehead. While there is no cure for rosacea, there are several ways to manage the symptoms and prevent flare-ups. One of the most effective ways to manage rosacea is to identify and avoid triggers. Common triggers include spicy foods, alcohol, hot beverages, sunlight, stress, and certain medications. Keeping a diary of symptoms and triggers can help identify patterns and allow for better management of the condition. Topical medications such as metronidazole, azelaic acid, and ivermectin can also be effective in reducing inflammation and redness associated with rosacea. These medications work by reducing the number of bacteria on the skin and decreasing inflammation. Oral antibiotics such as tetracycline, doxycycline, and minocycline can also be used to treat rosacea. These antibiotics work by reducing inflammation and killing bacteria that contribute to the condition. However, long-term use of antibiotics can lead to antibiotic resistance and other side effects. In addition to medication, there are several lifestyle changes that can help manage rosacea. Gentle skincare, including the use of mild, fragrance-free products and avoiding harsh exfoliants, can help reduce irritation and inflammation. Sun protection is also important, as UV rays can trigger flare-ups. Wearing a broad-spectrum sunscreen with an SPF of 30 or higher and avoiding direct sunlight during peak hours can help prevent flare-ups. In severe cases of rosacea, laser therapy or intense pulsed light therapy may be recommended. These treatments work by targeting blood vessels in the skin and reducing redness and inflammation. Overall, the key to managing rosacea is to identify triggers, use appropriate medications, and make lifestyle changes that reduce inflammation and irritation. While there is no cure for rosacea, with proper management, most people with the condition can lead normal, healthy lives. I hope you found this information helpful. Please consider subscribing and setting notifications for future updates.